Hi, you're about to watch an iMovie presentation about reducing hospital-acquired infections. This movie has been brought to you by Mavis Boateng, Allison, Roell, and Erin, Wanger. Hope you enjoy. A hospital-acquired infection, also known as a nosocomial infection, is an infection whose development is favored by a hospital environment and is acquired by a patient during a hospital visit. They are caused by viral, bacterial, and fungal pathogens. The most common types are bloodstream infections, pneumonia, urinary tract infections, and surgical site infections. Risk factors that can increase the likelihood of a patient contracting a hospital-acquired infection include previous hospitalization, 8.4 days or longer in the hospital, patients who just had surgery, patients who are on internal feedings, patients who are mechanically ventilated or were previously using antibiotics. On our floor at the Daniel Drake Center, almost all of our patients meet every single one of these risk factors. Current guidelines to promote patient safety and reducing the spread of hospital-acquired infections include putting the patient into an isolation room, donning personal protective equipment before entering the room, and performing hand hygiene. Hand washing should occur when hands are visibly soiled. Otherwise, a hand sanitizer should be used before touching a patient, after touching a patient, or after touching a patient's surroundings. Hand sanitizer pumps are used as one of the main ways to stop the spread of germs in the hospital environment. They are conveniently located for staff and patient family members both inside and outside of the patient's room. However, when we were doing our clinical at the Daniel Drake Center, we noticed that many of the faculty members were forgetting to use the hand sanitizers, which was leading to an increase in the number of patients with hospital-acquired infections. For this reason, we developed our PICO question to be, among hospital staff, what interventions can be used to increase compliance with hand hygiene guidelines? We use the University of Cincinnati Library and online databases like Sonal to find our studies. We use keywords like hand hygiene, compliance, isolation, washing, and sanitizer to find our results. We selected English only and narrowed our search to the last 5 years. We found 3 articles, all of which were research articles that use quantitative evidence. One article was a systematic review, one was a randomized control trial, and the other was a quasi-experimental. 2 of the articles we found were level 2, one was high quality, and one was good quality. The other article was a level 1 with a high quality rating. All of our articles consistently use hospital settings with the implementation of different methods to increase hand hygiene compliance. Overall, the articles seemed to agree on a few things and reported highest compliance when there was education and follow-up about proper hand hygiene technique. Together, we developed an intervention based on our findings to promote hand hygiene compliance, consisting of continued education with repercussions for lack of compliance, and individual follow-up reports after a certain length of time. This will decrease the number of hospital-acquired infections, saving the hospital money and reducing stress and the length of stay for hospital patients. Thank you so much for watching our video. We hope you were able to take something from this and learn a little bit more about hospital-acquired infections and how the use of proper hand hygiene can help prevent them.